Guys, how are you all doing? I know it's been like just over a month now since my latest upload. Of course, I do hope you all understand, and just by the title of this video, why I haven't been uploading any content now for quite a long time. This video is going to be a little bit different. Obviously, this is nothing that I planned on making. This is nothing that I planned on happening, of course. But yeah, the reality is I just managed to survive a COVID-19 infection here in Brazil, at a public hospital, and it actually turned out quite serious. I was almost just fighting for my life a couple of days, and of course I feel like it would be a good idea just to share the experience with you guys, and not only just to share it with you, but I really wanted to document this for myself as well, for the future, because this is something I have never experienced before. This is something I hope I will never ever experience again, and I hope this is something that the majority of you guys will never have to experience, because this was something just really frightening, something really different. So I thought I'd spend these next, an hour. It's gonna be a long video, this one here, but I've got a lot on my mind, a lot of stuff that I wanted to tell you and share with you. So if you all want to bear with me, then I can tell you how my latest 15 days here in Brazil has unfolded. Alright guys, just a little bit of heads up. This is going to be like a really long video. It's going to be super long. There's going to be a lot of talking. There's going to be a lot of maybe interesting parts that maybe not so interesting. I'm going to leave timestamps for you guys down in the description here in the video. You can just have a look. I'm going to write, the timestamps, whatever the interesting parts are. If you want to jump ahead straight and you don't want to listen to every single thing that I'm babbling about, if you don't want to know about my medication, if you don't want to know what I went through here my first day at the hospital, if you don't want to know about my symptoms, I'll leave timestamps here so you can just skip ahead and go back and forth however you wish, okay? Thanks guys, enjoy the video. Before I continue, also it's important that you know that I got out of the hospital three days ago. I am still short of breath. Actually, my lung capacity is at around 40% at the moment, and obviously I'm in full recovery mode still. So just bear with me. There could be some pauses and where I need to catch my breath. But of course, I'm gonna do the editing of the video. So it's just sometimes I might jump ahead a little bit, and that is a reason why I just need to catch my breath. And also an important thing to keep in mind is I was at a public hospital. I have made a previous video a couple of months back where about the healthcare system here in Brazil. You know, with the healthcare providers, the healthcare plans, you know, everything that you need to know if you do move here to Brazil, and how everything works. Of course, I covered that in another video, so I'm not going to be talking too much about that in this video, because this is more about what happened to me and how they took care of me here in Brazil at a public hospital. But if you want to check that out, my other video, which goes a little bit more in depth of how the hospital systems and how the healthcare everything works here in Brazil, I'll leave a card right up here, or you can have a look down in the description underneath the video. I will leave a description with a link to that video, okay? So you can check that out if you want to. This video, I'm just going to be talking about what actually happened to me and my experience. So, just for the record, it is currently Monday, the 21st of June, 2021. Now, on Friday, the 4th of June, was when I actually had my first symptoms, where I felt my first symptoms of the COVID-19, the coronavirus. And it was actually a couple of days, you know, prior to that I had been to the academy, just working out here in the city of Paracuru, you know, where I have my business, where I live. And that is where I really suspect that I contracted this virus. And the reason I suspect that is because I've always been vigilant. I always use my mask, kept my distance, did the social distancing and everything. And I've always been quite careful. But of course, in the academies, you know, people are going around, they sweat, they leave their, you know, I tried always to be really careful, you know, with alcohol and wipe off all the surfaces. But I think in a gym, in an academy, you know, it's really hard to keep everything sanitized at any one time. And of course, people are doing heavy lifting, heavy breathing, you know, and there's just a lot of, it's so easy. I think the virus is just helped so much more by that fact that it's really hard to control the virus in that sort of environment. So, but anyways, that is, I'm 99% sure that is where I did contract the virus a couple of days earlier in the gym. But anyways, come Friday, June the 4th, out of Friday, I was actually heading into the city of Fortaleza. I wanted to do some paragliding, and I also wanted to meet up with some friends. And I was actually just driving my car, going into the city, and where I felt that, yeah, there's something in my throat. You know, I've got some itching going on. There's something not really right. That was like the first sign. So when I finally got into the city, I've already booked a hotel for the weekend. It's fine. I checked into the hotel, and that first night I actually I just ordered some food in, and I was gonna go flying the next day on the Saturday. That Friday I didn't really feel like doing anything, so you know, it was just stay inside the hotel room, watching Netflix, and order some food. The next day, Saturday, early morning, I did wake up feeling quite down. That was the first indication that I actually had a fever, and that's when I kind of started connecting the dots, that, okay, maybe there's something else, maybe there's something more going on here. So what I did then is I actually there was like a pharmacy just down the road. I went down and I got myself a thermometer just to see if I did have a fever, and Lord and behold, I had around 38 degrees. I don't know how much is in Fahrenheit, but 38 degrees Celsius, that's considered, a slight fever. So I figured, okay, this is probably not gonna end well. So I decided just to stay at the hotel, just to keep it safe. So I just decided to stay in, just rest, just stay at the hotel room, watch some TV, and just see how this progresses. Maybe it's just like a small flu or some stupid, some whatever. Maybe it'll pass, Of course, that didn't happen. Everything just got gradually worse. Come Sunday, I was already 38.8 degrees, almost 39 in fever. I was feeling pretty down. And that's when I actually, decided that I need to get myself tested. I actually went down to this clinic, which is open on Sundays, just to get myself tested. However, they asked me when I actually got the first symptoms. I told them it was on the Friday, so they told me, okay, so it's Friday evening, so you really need to have at least 3 days of symptoms until, just to make sure that you don't get a false negative. Because what can actually happen is just the incubation time may not be enough for it to actually give a positive result. So I could take this test on the Sunday and it can come out negative, but then they still want, if you don't get better, you need to take another test on Monday again. So it's just, you might as well just wait. So that's what I did. So I went back to the hotel again. I waited for another day. Come Monday, I actually felt a little bit better. The fever had gone down a little bit. I was feeling a little bit better. That being said, I also have been taking paracetamols just to suppress the fever a little bit. But I was actually feeling a little bit better at that time. But anyways, it was around, I think the clinic, they open at noon, around 1 o'clock. And that's when I took the test. And usually this test is just like it's like an antigen test. It's quite quick. It takes around 40 minutes to get a result. My test came out positive within 3 minutes. She did the swab and she put it on, this pastry or this plate. It's almost like a pregnancy test. You get 1 line or 2 lines or whatever. That shows if you're positive or negative. I mean, it took like 3 minutes. It came out like just a clear positive. I don't know if you can call it full-blown COVID in my system. But anyways, it was positive. So that's when things kind of got a little bit interesting. So the way things work is like the next step when you do get a positive test. You obviously need to see a doctor. You need to get your medication and you need to get evaluated, if how serious it is and all of that stuff. So that is like the absolute next step. Now, this is where it gets kind of complicated for me in my situation because I do have health insurance here in Brazil. I can go into any private hospital and get full coverage and they will treat me and everything will be, dandy, and it's not really a problem. The difference is with my health insurance and the health plan that usually you will usually pay for here in Brazil is that, of course, here you will pay for a health plan, a monthly fee, and you get like a card. You present this card when you get to the hospital, when you get sick, and of course they will admit you or they will treat you, do whatever. You don't pay anything because that's already included, in your monthly fee. with my health insurance, which is part of my business that I have in Norway, it works a little bit differently in the way that I have to use my credit card. I need to pay for all of the expenses, everything for myself. And what I do is I just gather all the receipts and everything. And when the treatment is done, when I'm all done, that is when I can get reimbursed everything that I've actually paid for, during my medical or hospital visits. So that is the big difference. That is how the big difference is how my health plan here works contra to how the usual, Brazilian health plan works here. So, but anyways, the first thing that I actually did was visit the private hospital. Of course, I wanted to get a consultation. I wanted to get, the best possible, diagnosis and all of that stuff. And of course, I've been sick here before, and there is one hospital in Fortaleza in the city that I always use when I do get ill, and they've been fantastic. It's a good hospital. They have good doctors. They have the best equipment, everything, and the price is reasonable. It has always been reasonable. So I went to this hospital after I got my test, and I just went in straight to the emergency room because that's where they want you to go when you're actually infectious. Yeah, they don't want you to sit obviously and start infecting other people in the waiting lounge. So I actually went straight into the emergency. I told her I just got a positive test. I need to see a doctor. So I got. So they just got my information and they told me how I want to pay, and I told them, okay, this is going to be my own credit card, and I just need all the receipts and everything. And then they asked me, have you been informed how much is the consultation? And I told them no, but I've been here before, and I figure, I have an idea, but just tell me anyways. And that is when I kind of got blown away, because what it seems have happened, during these pandemic times. I don't know if people start getting greedy or what's going on, but the price of a consultation has quadrupled just for a consultation. It's around $250 just to see a doctor. I mean, that's just to sit down and talk with a doctor. And then you got all your tests, your exams, and you got your medication, and then everything, it's and I could already see that I'm gonna max out my credit card like so fast, and it's gonna be a really big issue for me. So at that time, I obviously was extremely disappointed, because I felt like this was like extortion almost. It's like just taking advantage of a situation of a pandemic. But I guess that is just how it is, everybody just gets greedy and wants, to make money. So I just told them that, no, I'm not going to do this. I'm going to go back to my hometown where I have my business, and I'm going to go straight to the hospital there and see a doctor there. And that's going to, at the public hospital. And because I was actually not feeling so bad at the time, I was actually feeling somewhat better. So what happened next? I just, I just left the hospital, the private hospital there in Fortaleza, got in my car and started driving back home. Okay, so currently it is June the 7th, Monday, and that is already well beyond 3 days of feeling my first symptoms of the coronavirus. And also, I just received the positive test as well. I arrived at the public hospital here in my town around 6 o'clock in the evening. And I just took all of my positive tests. I went into the reception. I told them I've tested positive. I need to see a doctor. I need to get, just everything checked out. So they asked me to sit down, and how it is with the public hospitals is it's just a lot of waiting, and this is when I'm gonna start showing you a little bit of footage, because I'm sitting around. I thought it would be nice just to show you guys the standard of the public hospitals here in Brazil and how they look like, just to give you an idea. It is quite a miserable place to be, but for some reason when I was there it was actually kind of quiet. It wasn't that busy actually, so it was it was fine. But anyways, so I'll show you, while I'm talking, I'll show you a little bit of footage of the hospitals and the local hospital here, and how it looks like, so you can get an idea. But anyways, so I was there waiting to see the doctor. When I finally got in to see him, I showed them the positive test, and the first thing he wanted to do was just have an X-ray of my lung, just to see if there was any damage done to that already. And of course they wanted to give me medication straight away, and that medication is something that they actually give all the coronavirus, the COVID-19 patients here in Brazil, which is corticosteroid. I'm gonna try and explain a little bit what this medicine here is. I'm gonna get back to that. It's prednisone, 20 milligrams. You can get it in tablet form. Obviously, I got this through IV. Was like a half a liter, 500 milliliters, just straight IV into the veins. And so I got that administered, and also I got a photo of my chest. So when I was actually sitting down and just receiving, my IV drips of my prednisone, that's when things just really became a really strange. What actually happened is I was just sitting in, they put you in the corridor, you just sit, in a chair, just while this medicine drains into your veins. And I think I was around 50 minutes into the treatment, and they just came with this this trolley with a body bag, just this big body bag. Somebody who had just recently passed away from COVID-19, and for some reason they thought it was appropriate just to park it right in front of me, and they just left me there with this body bag for around 10 minutes. It was not really a nice feeling. And they actually, when they did come back, eventually, they just had it was just like a big sticker, I think, with all the personal information of this person, this individual who had passed away. And it was just like a sticker, so they tore that off and they put it on the body bag. And as soon as they did that, they actually just rolled the body bag out into the waiting room. And as soon as they opened the door, it was like taking out of like a war movie or something like that. It was just because all the relatives were out there waiting, and of course when they saw the body bag come out, it was really just tragic, crying, just sobbing. Um, I don't know how it is. Maybe like for us in Norway, I don't know about maybe like it's like maybe a cultural thing as well. I don't know, because like I'm not used to just this overly crying and screaming and emotions. Like I'm more used to people holding it like in like more. I don't know. This felt like so exaggerated, but I know that people react so differently. But it was just, for me, it was so exaggerated, the screaming and the sobbing, and it was like, it felt almost like a slaughterhouse as soon as they rolled that person out there. And it was just, it wasn't pleasant at all. It was like a really, really just. But anyways, I was there being treated for COVID, and of course I wasn't feeling that bad at the time, but it was a surreal experience for sure. And what happened actually 15 minutes later, they probably rolled out this body bag, and they identified the body and everything, and they probably put it into a morgue. But what happened actually 15-20 minutes later, it was so surreal, because then they actually wheeled out from the same room where this individual had died. They wheeled out this, she must have been 90 years or something like that, this old lady in a wheelchair. And they wheeled her out, and when they opened the doors into the waiting room again, and there were just families with balloons and cheering and applauding, and this was actually a survivor who had managed to pull through this COVID-19 infection. So it's like it went from 20 minutes, it just went from just pure horror, pure sadness, to just pure delight and pure joy in just like a 20-minute span. And it was just something so surreal, so really, really strange. It's hard to put into words actually what actually went down. Okay, so I got my x-rays, I got my medicine. It's around 10 p.m. so I was able to leave the hospital, and of course I stopped by the pharmacy, got all of my medicine that I need to take into tablet form. I'm gonna get back to you about the medicine that they subscribe here for COVID. But so I got home the next day, Tuesday. I woke up still running a fever, and I'm still taking my paracetamol, 700 milligrams, of paracetamol, around 3-4 times a day, just to try and suppress the fever. And surprising enough, this fever, it's relentless. The fever that comes with the COVID, it's just relentless. As soon as you take your paracetamols and you get your fever down, a couple of hours, it's immediately starts creeping back up again. So my fever is 30 it's 39 degrees Celsius. What's that, like 102 degrees Fahrenheit, something like that. So it's been like that for 8 days now. So I'm like taking 1,000 milligrams of paracetamol. Like I'm trying not to take it like more than 3 or 4 times a day. My breathing is better.
so it's a lot better than it was a couple of days ago. But so it's still I don't know, still scary. Fever is the worst. I hate the goddamn fever. You feel like such a shit. I mean, and it's like I can't even make a closed fist, almost like there's no. And I've got like this muscle cramps also in my legs, and it hurts. Oh my god, it hurts. It hurts so bad. Actually, I'm just waiting for a sign of improvement here. 8 days with symptoms, and it's just gradually gotten worse. It's I don't feel like I reached the top or reached the bottom. However you wanna, however you wanna look at it, yeah. But this COVID is it's no joke. It's no joke, guys.
But I was like feeling all right, I still had some energy, but that was on the Tuesday, and come Wednesday things would really start to change, and that's when things just got out of control and serious. So the next couple of days, Wednesday, Thursday, Friday, the fever, it just kept going up, and I had to take more and more paracetamols just to keep the fever in check.
Okay, so I had fever 100 fever of 40 degrees Celsius, which is 104. And I just have this cough. It's not going away. It's currently day 8 of my COVID. And and 8 days straight with just a high fever, like 39 to 40 degrees Celsius. And it's the fever that's killing me. I mean, it's the fever that's the worst. And I'm just taking like 5,000 milligrams paracetamol, like per day. And it feels like I've just pissed my bed like every morning. It feels like I pissed my bed because it's just soaked from sweat. I'm changing like my t-shirts 5-6 times a day. And it's tough, man. But this cough also is really getting to me. Shit.
It was painful because it just drains all the energy out of you. You have a massive headache. You're always sweating. You are weak. you lose your appetite. And at this point also is when I actually got the COVID cough, which is basically just a dry cough. And you just cough and cough and nothing, you can't release any phlegm or anything, it's just dry, and you keep on coughing. And the coughing as well just drains the energy out of you. And of course, fever and everything like that. And it wasn't actually coming into Friday that I started to feel a little bit of chest pains. And this was on the Friday. It was already 1 week into, after having the first symptoms of the COVID. So it just progressively got worse and worse and worse by every single day. And I was at a point where I was quite miserable. Now, I'll show you here just a small clip of me just measuring my oxygen level. And it's just basically just a small apparatus you put on your finger, and it measures your heartbeat, and it also measures your oxygen saturation level in your blood. And you want to keep it always at around 97-98%, which is ideal. If it dips underneath 93-92%, that's when it gets really dangerous and you need to be hospitalized. So I was managing fine, 94, 95, 96%. It wasn't really a problem. I could still, I still had quite good oxygen saturation levels in my blood at the time. So that wasn't like the big concern at that time. However, it gradually just started to creep down, get a little bit worse every single day. So I just want to talk really quickly about the medication that they give me here. Obviously, I'm not a medical expert. I have no clue. I'm totally like an idiot when it comes to medication. The most I know is paracetamol, so will take your fever down. Aspirin, it will kill your headache. That's my expertise on medication. But I think it's quite interesting just to see what medication that they give you here, and this is very typical of most, 90% of patients will receive who have the COVID infection here, and it's basically it is this one here. It is prednisone, and what it basically says here in the is prednisone is used to treat conditions such as arthritis, blood disorders, breathing problems, which is obviously what I'm using it for. And it says prednisone belongs to a class of drugs known as corticosteroids. So corticosteroids, sorry. So it decreases your immune system response to various diseases to basically reduce symptoms such as swelling and allergic type reactions. And so it's quite powerful stuff. And I was actually in touch with a medical professional in Norway because I wanted to know. I'm not the person who likes to take medication just without actually knowing if I really need to take it, if it's absolutely necessary, and of course I consulted with this specialist in Norway, and she was actually a little bit surprised of why they would administer this, because usually when they give out this medication here, it's for people who are already very severe, have severe breathing problems. Usually what they do is with the COVID-19 infections, usually they put it into 4 categories. So you have the mild category, you have the moderate, you have the severe, and then you have the critical. So obviously, with the mild and the moderate forms of COVID, you can basically stay at home and do your treatment at home. Of course, the severe, you need to go to the hospital, and critical is, it's a life and death matter. And what they say is usually they only give this here when it's actually severe or critical conditions, because this here, it lowers your immune system. So what actually happens is, if you just take it like at home, and you're still able to breathe on your own and your lungs function, it can actually take down your immune system, and you can actually it can make you worse. But so in the beginning, she actually told me maybe not to take it, but after a lot of consultation with her other specialists there, they figured like maybe in certain cases it's just best just to take it anyways, just to be sure. So even nowadays, we're already almost 1.5 years into this pandemic, and the doctors are still a little bit unsure what is the actually best treatment, what is the best course. And it's kind of scary, because of course you figured like by now the doctors, everything, they should know enough that there shouldn't be any question about what medication is safe to take and when you should take it and how much. But anyways, there was actually quite a lot of discussion back and forth, but in the end they decided that I just need to go ahead and take that medication. And the other medication, apart from this prednisone, it was just basically just antibiotics just to fight infection. So those were the two medicines, and of course the paracetamol just to keep my fever down. So that's it of the medication part. And of course I was taking like vitamin C supplements, zinc, and that was also like a really big debate, because the doctors there, they told me it's very important to keep your supplements, vitamin C's and zinc and vitamin D's, all of that stuff in check. My medical professionals in Norway told me that you don't want to do a lot of vitamin supplements, because you want to like save that on your kidneys and liver or whatever. You don't want to. You want your body to try and treat as much as possible as the disease. You don't want to put any more strain on your other organs. But anyways, okay. So June the 14th, 1 week exactly prior to today, and it's around 1 o'clock in the morning. I wake up. I have 40 degrees Celsius fever. It's I think it's like 104 degrees Fahrenheit. I need to go to the bathroom, and I'm not able to stand on my 2 feet. My breathing is heavy. My cough is severe. And I put on my oxygen meter, and it's at 92%. And that is when I absolutely panic, and I call one of my staff who works here at the hotel. He actually spends the night. I wake him up. He is sleeping. I get him and I tell him I need to go to the hospital right now. So he managed to just pack some stuff for me. He really has to carry me down into the car. He drives me to the hospital. I get to the hospital, and of course I'm admitted immediately. What happens then is I immediately get an IV. You can see this guy, he really did a number on me because he tried to push this needle in like 2 times, 3 times. I don't know if this guy was like a temp or something like that. He just couldn't find a vein and he just like jammed this needle like 2-3 times. I was in so much pain, I was screaming, and eventually he managed to get this needle in somehow, and he managed to administer, you know, the medicine, which was basically just more of this stuff in liquid form, just steroids, you know, just trying to, and of course it's a mix of antibiotics as well, just to try and to reduce the any infections that I might have had. But I was in a really bad state at that time, and it's incredible to think that this is just 7 days ago from when I'm sitting here talking to you guys now. And I don't remember that much after that. I think I blacked out. I was so weak. So that's when I had some sleep. So basically, the next day, when I woke up at this hospital here, I mean, I was stabilized, I was getting better, I was able to breathe somewhat again, still heavy breathing, but, you know, I was getting my medication through IV. I got to see some of the doctors, and they told me, like, you'll probably get better. You know, it's just gonna take time, take patience. But remember, I'm in a public hospital in my town, and it's there's not like a lot of it's not a specialist hospital. You know, none of these doctors, none of these nurses, nobody has any idea about how to treat COVID, you know. These guys are basically almost reading this out of a book, out of like a medical manual or a medical guideline, if you want. But I felt safe at the time. I felt like, God, this is going to be okay. I just need to lay down here, rest, and things are going to work out. So we're still in the Monday, because I arrived at the hospital. It was like 1 o'clock in the morning on a Monday. That's when I got admitted. And now we're talking around 6, 7 o'clock in the evening, same day at the hospital. And these 2 girls come in and are gonna disinfect the room. And for some reason, they thought it was a brilliant idea to just come with bottles of concentrated bleach, which they just poured all over the floor. And as soon as they threw this bleach on the floor, I could feel the fumes just starting eating away at my lungs. And it was like somebody just hit me with a sledgehammer in the chest. And I started screaming immediately in pain. I wasn't able to breathe. I immediately started coughing. I just panicked, and it was just hysteria. And of course, the doctors, everything, they came running and wondering what was going on. And I think luckily they actually noticed that they were, you know, washing the floors and all the, you know, this is a closed room. It's an air conditioning room. It's actually a closed room with air conditioning, so there's no ventilation. And they're throwing like concentrated bleach on the floor. So they actually managed to just diluted out with water, this bleach, and I managed to get it under control. Like a couple of hours later, I was able to get my breathing somewhat back again. But then for some reason, they decided to do the exact same thing just out in the corridor, but that was enough. They threw, concentrated bleach on the corridors outside, and it came inside the room, the fumes, and I immediately started to really feel bad again, and just started coughing, and I just started screaming. And at that time, I was really pissed off, and I told them that I want to go home. I don't want to stay here because you guys are literally trying to kill me. That's what I said. If you guys want to kill me, I'm not going to let you kill me. Just you guys get me straight home right now. And at that time, the doctor came in and they told me, no, you're not going to stay here anymore. We already arranged for an ambulance because now we're going to take you to a specialist hospital in Fortaleza, in the big city. And I thought, okay, well, that is much better than staying here anyways. So it was around midnight, and they actually wheeled me out into an ambulance, and around a 2-hour drive into the city, in the back of an ambulance at in the middle of the night. And at that time I was just exhausted. I was totally out of it, still running a high fever, coughing, and I think I passed out, just prior to arriving at the hospital. Tuesday, 15th of June. So it's a day after where I actually arrived at the hospital in Fortaleza. And at this hospital, it was this was a little bit different. Here I shared the room with 2 other guys. One of these was laying on his stomach. He was in a really bad shape, in a bad state. All COVID-19 victims, yeah. And I remember at this hospital, it was I had my bed just all the way up to this huge window, and this window, the sun would just shine through and hit my bed, and it was like just laying on the beach and just sunbathing. There was no curtains on this. There was just no curtains on these windows whatsoever. So it was extremely bright and extremely hot. And there was just like these 2 industrial fans just blowing air, trying to ventilate a little bit, but it really didn't help a lot. That was kind of a miserable wake up, in a public hospital in Fortaleza. I thought, oh, this is going to be bad, this is really gonna take its toll on me. But I was feeling quite bad as well. I could barely stand. I couldn't stand. I couldn't stand on my 2 feet. And the nurses, they wanted to give me a bath because I have been sweating quite a lot from the fever and everything, and they wanted me to. They thought, okay, let's get you into a shower and take your bath and see if you feel better, And keep in mind, at this time, I have oxygen. Yeah, so I have like oxygen in my nose to help me breathe. I also have my IV for the medicine. So I've got all these tubes, and it's like just getting into the shower, and they follow you with this oxygen tank, and you got your IV fluids as well, everything. It was like just tubes and everywhere, and but anyways, they managed to give me a sponge bath, give me a good scrubbing, and of course I got clean eventually. laid back down in my bed, and I stayed there for the remaining of the day of that Tuesday there. When we finally came into, later in the evening, the doctor came in to see me, and he told me, like, okay, tomorrow we're gonna do an X-ray again of your chest, everything, to see how you're getting on. So I said, okay, that's fine. Next day, Wednesday, 23rd of June, is when they took their X-ray of my chest, and my breathing had got better, and the doctor told me, like, we're gonna move you again. My first initial thought was, I can't be moved again. I don't have the energy. I don't have the. I don't want to be moved again, because now you moved me. It's like third time already. Just please, just let me lay in bed. Let me be alone. However, this place where they're gonna move me now was actually like. This is like a provisionary. Is that why you call it, like a provisionary, just like a temporary facility that they put up during the COVID pandemic. It's just basically like a tent. It's just like a closed tent with a lot of just bed posts and fully air conditioning, fully climate controlled area. And it's basically where you spend your recovery days before you're allowed to go home. And so they were going to put me into one of those areas, and so I got transferred down there into this recovery tent. And I have to say, I was pleasantly surprised at how nice and clean and new everything was down there. So I got my bedpost there. And keep in mind, as soon as you're admitted to a hospital in Brazil, they take your cell phone away. They take everything away from you. Of course, I was allowed to make a few phone calls, or I had my emergency contact numbers already down, so my closest relatives already had been informed what was going on with me. But of course, you are kind of like in the dark. You don't know what's going on, and you're not able to communicate with everyone because you're not allowed to have a mobile phone. And when I came into this recovery how do you call it, like this recovery place down into this tent that they put up, I actually got my phone back again for the first time, and I was like in heaven. And just, it was so nice to talk with my family back home in Norway, my mother and all my relatives and all my friends, and just let people know that I was okay. I was going to survive. Everything was going to be good. And just that alone really helped me feel a lot better. Just for the whole recovery process, it really helped a lot. So the next couple of days actually was the days where I would see an improvement of everything, of my breathing. They finally managed to kill the virus, so my fever just went away. My cough eventually went away, and it just gradually got better. Of course, in the first couple of days, I was just weak. It was just weak. I needed help. They needed to put me in a wheelchair. I was on oxygen 24 hours, oxygen my nose breathing. And I was in a wheelchair. I needed to be wheeled out to go to the bathroom or take a shower. You basically piss in a bag. And it just gradually got better. And the good thing is also is you probably already know this, that COVID it takes your sense of smell and your taste away, and that is also was one of the hardest parts, because it's just like all I still had certain amount of taste, but it's all salt. There's no sweet. There's just no flavors at all. Everything is just like super salty. It's like anything you put in your mouth is just salt. It's just like pure salt. So when I got my taste back as well, along came the appetite, and I was starting eating the hospital food, which wasn't really anything interesting, but at least, so as soon as you get your taste back, you kind of start to enjoy some of these flavors again, and then you kind of get your appetite back and you start eating. And it's just a whole snowball effect, as soon as you kill the virus, as soon as you don't have the fever, as soon as you start getting a little bit of energy back, and as soon as you start eating again, it's like your body, you feel just like the energy, you feel your body just healing every single day. And it was just an amazing feeling. And so gradually I was able to stop with oxygen. That was about 24 hours before I was able to leave the hospital. And they were just monitoring me. And but of course, I still got my prednisone in IV fluids every single day through my IV, every single morning. And they do your blood work. They check they do so many tests, just a bunch of blood works, and they check your EG, I think it's called. It's just EG is just to check they put up a bunch of probes on your chest and run you through I think it's called an EG meter or something like that, just to see if your heart is working, your ticker is working normally, and just a whole bunch of tests. There's just testing all the time, which is good, I guess. They really take care of you. And just a bunch of medication, different kind of medication for the heart, for the lungs, for your cough, for everything imaginable. So eventually, this was when I got into this tent, this recovery tent. That's when things really started to pick up, get better. Saturday, June 19th. That was the day, probably the happiest day of this year, by far. And of course, this was the day where they finally allowed me to go home. And I called a friend of mine who lives in the city, and I told him, please, I've got nobody to take me home, can you just pick me up? He's a champ, he's a good friend. He came up, picked me up from the hospital. I got all my papers. I talked with the doctor for the last time. There is a bunch of medication that I need to take. There is a long recovery. I also I forgot to mention that the day before they put me into this big seen these big magnets, the big magnets that they looks like an MRI machine, when they scan your brain, but they can take like pictures of your entire lungs. So they took, I think it's like a thorax image of your thorax, something like that. They told me it's basically like a really detailed image of your lungs and everything, just to check how it is. And the conclusion there was like I have 40% lung capacity at the moment, and I do get extremely quickly out of breath. So just brushing my teeth, it's like running a marathon, just getting out of bed. and that is also why I'm talking a bit slow. I'm taking big breaths. I'm taking my time, but that is part of the recovery from COVID. But anyways, that was a little bit off track. My friend, he came and picked me up, and Saturday night I was back home. I managed to watch the sunset here from my room, and it was just an amazing feeling. And yeah, I did cry a few tears that night, but it was a fantastic feeling to finally be home again. I'm back. I pretty much, survived this virus. However, there is quite a long road ahead for recovery still. Like I said, my lungs are not where they need to be just yet. And with this medication here, with this prednisona, I can't stop taking this straight away. That will probably be really, really bad for me. I don't know, it can cause a heart attack and just cause my stop breathing or whatever. That is like the little bit scary part of this, taking like these steroids that take down your immune system. So these I need to take for almost a month, but gradually just stepping down, just taking a little bit less every single day, every single week. But so, and also of course I can't work out, I can't do anything physical. I just really need to take it easy, and that is part of the whole process of rehabilitation, of just getting better. So basically, I mean, that is my story. That is what has happened to me here, and I think I wanted to document this for my personal reasons as well. But I think, if you think that this is interesting and you also just an explanation of what's been going on with me, for the last couple of months, because I haven't been active on this channel. I haven't been uploading anything. But I want to give just my final thoughts about healthcare and the public hospitals and how they treated me here in Brazil. And to be honest with you guys, I really got to, the local hospital here where I'm staying here in Paracuru, here in the city where I have my business, I would never ever want to spend another night in this hospital, because It's basically just an emergency um, receival center, you know. They will take you in and they will do whatever they can to the best of their ability to keep you alive. That's it. But the specialist, you know, if you need specialist help, if there is anything like really serious going on with you, you need to get out of here. You need to go to a proper hospital in the big city. No, that is exactly what happened to me. They took me to this specialist hospital in Fortaleza, in the big city. And I have to say, um, the doctors, the nurses, everybody there, they were all extremely professional. They did everything they could to make sure I was comfortable, that I had everything that I needed, that I stayed positive, that I was going to get through this. They checked up on me every single like 15, 30 minutes. They came and checked up if I needed anything. They did all their exams. They did all their checkups. You know, they did. I can't say that I had a worse treatment there than I had like at any private hospital, say here in Brazil or even in Norway, you know, or even anywhere else where I've been to a hospital. I cannot say that I got a worse treatment at the public hospital there in Fortaleza. I got to give it to them hands down. I was pleasantly surprised and I felt safe and I felt like I was in good hands at that time. So that is my take on that. I would still have a health plan here for sure. Get a health plan so you can have the best doctor, so you can have the best health care. Of course, you want to have that. For me, this is something I'm going to actually consider, because even if I have my health insurance, I still need to pay out, you know, I still need to use my own credit cards. And I'm going to max out these cards so fast, like with the prices that they're pushing today. So for me, previously, it was quite affordable. You know, usually I just had like an infection or something like that. You know, I would pay maybe like $500-600 US dollars on my credit card. I would get this reimbursed after that, you know, and there wouldn't be a problem. But of course, with this treatment here, it would probably run into the thousands of dollars, and I would max out my credit cards and I would have an issue, you know. So definitely something that I'm going to do for the future for myself is just get a health plan, because it's much less much less of a hassle, and it just gives you peace of mind when anything happens. So, but anyways, that is my take on that, guys. I mean, that's basically it. I hope you enjoyed somewhat my little story here, my little adventure into the into this COVID infection. But this is definitely the worst thing I've ever had in my whole entire life. It hurts. It screws up your lungs. It's an ugly virus. I know there's people who just get it and they don't even feel sick. I know. But every case is different. Every person is different. I'm an athlete. I work out. I'm a surfer. I'm a kite surfer. I do paragliding. I'm such an active person. I'm a healthy person. I live healthy. I eat and breathe healthy. And it almost killed me. This virus almost killed me. But and now I'm just, you know, I'm just a shadow of what I was a couple of weeks ago. You know, it's gonna get better. It's gonna get better. But just saying to you guys, please, guys, just be safe. Take care. This thing ain't over yet. We're almost vaccinated. We're almost at the finish line. But until then, just be safe, guys, and take care of yourselves, okay? And please give me a thumbs up, or subscribe to my channel, help me out, throw me a bone, and I'm sure, like, as soon as I make this recovery here, I'm gonna start making more pleasant, more proper videos for you guys. Talk about being unlucky. Just talk about being just totally unlucky, because this wasn't the plan at all. But anyways, it happened. Okay, guys, thanks a lot for listening to what I had to say, and I hope I'll see you again soon. Take care and be safe. Until next time. Bye bye.